Hey guys, welcome back to my channel. Today, my topic of discussion is AOGD April edition topics. Okay, first I'll tell about the laparoscopy with and without varus. So, varus needle is used to create the pneumoperitoneum. We all know that. So, we can use varus needle or we can use open technique as well. So, there are two methods. Uh, Followed by I'll tell the third method as well. So various needle generally it was introduced in 20th century. This is a spring-loaded channel. There is a spring in the needle. So after entering into the peritoneal cavity, it helpful to insert or allow the COT insufflation. Okay, but this is a needle. So there is a chance of bowel and vascular injury, and so the many surgeons follow alternative methods like open technique. Okay, open technique is something like on the abdomen they'll give an incision and they directly insert the trocar, and they'll tie these incision ends to the trocar. Okay, so under vision blunt trocar is used. So once you open the abdomen, you can see whether it is bowel or peritoneum or omentum is there, radiations is there. You can see. Okay, then you can insert the this blunt trocar. So first we'll learn about various needle technique. So it's a spring-loaded needle which is entering into the peritoneal cavity. Okay, and creates a new peritoneum. Advantages of this is it's a minimal invasive. So after removing the trocar, we can give it one or two stitches. That's it. And pneumoperitoneum quicker it is possible. Small puncture site, high safety margin, and you can use in gynecological and general surgery as well. Disadvantages is because it is a needle, it has an injury risk. Okay, then difficulty in placement. If there is an adhesion, it is difficult. Okay, sometimes what happens is it doesn't enter the peritoneal cavity. Pre-peritoneum only there is insufflation, which can lead to suboptimal working space. And the skin, if the gas enters under subcutaneous thing, it can lead to subcutaneous emphysema, gas embolism, failed insufflation. These are common. Okay. Now coming to open technique. The second method is open technique. Open technique is I already told. We'll give an incision, we'll insert the trocar and we'll tie it with the knots. Advantages of this technique is there is a reduced risk of injury. If there is any prior history of abdominal surgeries, adhesions, if we suspect, then you can go for Hassel's technique. Gas embolism is also less, and it helpful more control and secure the trocar placement. Disadvantages is after inserting, tying, and all that, so it takes a longer time for pneumoperitoneum. Large insertion, so there will be pain, gas leakage, and for example, rupture ectopic, we want to do emergency laparoscopy. Then this technique takes time, so not suitable for emergency laparoscopic procedure. I'm telling about the third technique now. So third technique is visual entry technique. Here there will be a probe. It is known as a real-time visualization. So there is an optical trocar. What? Optical trocar. So optical trocar is used. The real time of visualization it is used and we enter inside the abdomen. So there are some differences between these three techniques, VDs, open and visual technique. So entry speed is faster in VDs compared to open and visual. Risk of injury is higher in VDs because it's the needle. Okay. For adhesions, more suitable is open and visual entry. Incision size is smaller in VDs and pneumoperitoneum is high in VDs. Okay. So special consultation mainly in obese patients we can give this visual entry technique. Previous abdominal surgeries also this visual entry technique is best. Uh, One more new introduction is known as varice. What is that? Varice. Varice is like it has a like for example you have this modernized phones and all now which says what is the temperature in the room, what is the temperature outside and all. In that way VDC is something like a instrument which has pressure sensors in it and there is a real-time feedback mechanism. So once you're inserting it, it will tell you entered into the peritoneal cavity. Now you can give insufflation. It will tell, it will announce, or it will show on the monitor in that way. Okay, and it's a 2 abdominal axis visual entry device. Is this one? This is a 2 one, whereas optical trocar is 5 one. It is a 2 one. So incision also very small size. Okay, so conclusion point of this laparoscopy techniques, entry techniques is special innovations like varice is being considered now. Nowadays the study is being going on and key points is choice between VDs and opens and visual entry depends upon the patient factors and surgeons expertise as well. Because see, open technique is easy, but some surgeon nowadays surgeons doesn't know what is open technique. So depends upon the surgeon expertise as well. Okay, and Veeries has that high in high risk cases. If we insert Veeries, how to manage if you don't enter in that way, and visual entry techniques also are safely and efficient. That's about laparoscopy. Now we'll learn about should contraception be offered to teenagers or not. Okay, so see, teenagers are something like people of under 19 age. Okay, so the like 11 to 13 and under 19 age people are teenagers. So you can give contraception. Even WHO and American Academy of Pediatrics also says give contraception to adolescents who are sexually active, irrespective of their age, irrespective of the marital status, because contraception can prevent unintended pregnancies, they can prevent STIs and all. But POXO Act is there, it is under 19 Act. So in India, they will tell that first give contraception, then you can report the matter to the police that it is a POXO. Because if you don't give contraception, if you leave and he'll be pregnant, then managing that abortion is very difficult. Okay. So what is the benefits of contraception for teenagers? That's what. So we can reduce the risk of unintended pregnancy. We can meet the unmet needs of contraception. Maternal mortality is reduced, STI is reduced, HIV prevalence is reduced. It improves the nutrition and mental. See, contraception is something like condoms also we will give. So HIV prevalence will be reduced in that. Okay. It's a lower healthcare cost and more girls can complete their education instead of suffering from these health issues. Okay. So this article says that better go for LARC, long acting reversible contraception is best. Okay, so concerns is you can give a quick start. Like in more adolescents, if they want contraception, give a quick start. Okay, then American Academy of Pediatrics recommend that a 1-to-1 time with adolescents starting at spend 1-to-1 time. If adolescent come to your clinic, spend 1-to-1 time. What is 1-to-1 time? If the adolescent having a mother or father with her, ask them to leave the room. You talk with 1-to-1. Okay, a sensitive topic, sexual behaviors and birth control should be educated to them. Okay, don't give education that you are having very small age, why are you doing this and that. They already started. Okay, so just go for contraception and sexual behavior and birth control measures. Now coming to this thing, sex education comprehensive thing. Nothing more. LARC is something like you can go for implants or this thing. Implants or intrauterine devices can be given, and emergency contraception is morning after pill or copper T can be given in them. So, unprotected sex we can give these things, and emergency contraceptions can be given up to 120 hours after sex. So, conclusion is we can give contraception. Okay, we can give contraception, and there will be comprehensive sexual education and LARC and emergency contraception can be given. Okay. Next topic of discussion in this is vitamin D in pregnancy. Is very, very, very important topic, and I'm expecting this question in upcoming theory exams. Okay, so vitamin D actually deficiency it ranges from 18 to 80%. Remember like that. Okay, it depends upon the residence, ethnicity, dietary intake, and all. And amount of sun exposure is also important because many people are high risk, like vegetarians who live in cold climates, wear winter sun protection gears, ethnicity, particularly dark skin, have more likely to have a vitamin D deficiency. Okay, so food also you should have a vitamin fortified food to have. Food like cow's milk with fortified vitamin D, even pink salmon, tuna fish, egg yolk. Most of the people throw egg yolks, but egg yolk has 25 amount international units of vitamin D. Okay, so vitamin D generally, at least we need to have 20 nanograms per ml is a normal value to avoid any bone problems. So vitamin D deficiency if it occurs, there is rickets. Vitamin D synthesis is very important. So first, come to the skin. Okay, so you start with skin. So in skin, there is a substance known as provitamin D3. What is that? Provitamin D3. What is that known as? 7 dehydrocholesterol. Okay, in skin there is 7. Skin for 7. Skin for 7. So 7 dehydrocholesterol is there. So it's a provitamin D3. So it's something giving some pre something. What is that pre? So 7 dehydrocholesterol becomes Precholecalciferol. Precholecalciferol. It's a pre-vitamin D3. Okay. So this precholecalciferol, it is converted into cholecalciferol. This cholecalciferol is nothing but vitamin D3. Okay. So pre-vitamin D3 becoming the vitamin. If you don't remember any words, right? Pre-vitamin D3 converting into vitamin D3. This vitamin D3 goes and binds to the D binding proteins which are present on liver, These D binding proteins are there. It binds on that where this 25 hydroxy vitamin D3 is produced by enzyme 25 hydroxylase. Understood? So vitamin D3 will become 25 hydroxy vitamin D3 by means of 25 hydroxylase. This 25 hydroxy vitamin D3 in the kidneys, it becomes 125. This 25 becomes 125 dihydroxy vitamin D3 in kidney. Okay, this 125 dihydro vitamin D3 in the kidney is known as calcitriol. It is known as calcitriol. So I'm expecting this synthesis mechanism as a question. Okay. So this is very important. Remember skin, you have 7, that is 7-dehydrocholesterol. Will it become pre-calciferol? This pre-cholecalciferol becomes cholecalciferol, that is vitamin D3. Vitamin D3 is transported to D-binding proteins on the kid in the liver. In the liver, this vitamin D3 is converted to 25 hydroxy vitamin D3. This goes into the kidney and becomes 125 dihydroxy vitamin D3. Okay, this is the active form of vitamin D through its action. Okay, so normally bone mineralization growth may be possible only because of active form. If there is deficiency, there is skeletal homeostasis, congenital rickets, fractures in the fetus even. Mother having a vitamin D deficiency, fetus can also have these fractures. So minimum requirement of vitamin D is 20, I already said. So prevalence is North India have more prevalence of vitamin D deficiency and that you should write. Coming to states, African Americans have very high risk of vitamin D deficiency. Okay, so vitamin D deficiency in pregnancy and adverse effects is so if the pregnant woman is vitamin D deficient, they can develop bacterial vaginosis and babies can have low birth weight. Okay, so primary gravitas they should take at least 40 international units of vitamin D prophylaxis per day. Antenatal vitamin D deficiency is with hypertensive disorders, small for gestation age, oligohydramnias, low birth weights, and all. Vitamin D supplements may enhance the fetal growth and they can reduce gestational hypertension, gestational diabetes, preeclampsia, small for gestational age, and preterm birth. Okay, so all the vitamin D pregnant women should offer because it is also said that the child can have enamel defects less and attention deficit hyperactivity disorders, autism disorders are less if the mother take vitamin D. Okay, so every pregnant woman should take 600. How much? It should take 600 international units. She should take 600 international units. Every mother is recommended. Okay. Then coming to stages and adverse effects. For example, say I told 20. If it is less than 10, how much? Less than 10. Then it is severe deficiency. Severe deficiency. So mother will have preeclampsia, calcium malabsorption, bone loss, weight gain, myopathy, higher parathyroid hormone levels. And newborns will be small, small, small. So small for gestation, hypocalcemia, infantile heart disease, enamel defects, large spondylitis like congenital disc rickets if the baby is breastfed. Insufficiency. Insufficiency is 11 to 32. If it should be 20. If it is 11 to 32 is insufficiency. Then also you have bone loss in neonates, you have hypocalcemia and bone mineral density is reduced. Okay. Headache is 32 to 100 if it is present. 32 to 100 in nanogram per ml. Then it is uh, headache, calcium balance, parathyroid hormones. None unless exclusively breastfed. Toxicity is more than 100. Hypercalcemia, increased urine loss. Toxicity, if it is there is hypercalcemia, there is increased urine loss. And in neonate infantile, you have infantile idiopathic hypercalcemia. Okay. So conclusion is every pregnant woman should check the D levels and should take vitamin D in pregnancy as well. Next topic is last. I think this is the third trimester ultrasound. Is it useful or not in pregnancy? See, because we are doing so many ultrasounds. Third trimester ultrasound, particularly, is there is any use or not? So first thing is so if you do third trimester ultrasound, it is very important against the medical legal issues. Like if the baby died, then you can find some reason in ultrasound to say that baby died because of this reason. If you didn't do any ultrasound, and you don't know why baby died, then it will be very difficult to solve the medical issues. Okay. Look, routinely the third trimester ultrasound is performed at 30 to 34 weeks. Okay. Many anomalies are found affecting the genital tract, CNS, and heart. Okay. And in if a lady came in 32 weeks and she wanted gestational age, then you can measure by means of femoral length. Okay. Third trimester ultrasounds are important. Like, sir, for example, if you do third trimester ultrasound, there are new urogenital congenital anomalies seen about 55%. Okay, in that way. So, third trimester scan, you can see head microcephaly and all. In brain, you can see the egg area, dysencephaly. In heart, you can see the asymmetry of ventricles. In chest, you can see hernia. You can see abdominal small bowel dilatations. Urinary system is hydronephrosis. How can you find? Mainly hydronephrosis is very important because almost third trimester, the renal pelvis AP diameter is 7 mm. If it is more than 15 mm, that means there is high risk of uh, surgery after natally. So postnatal surgery, you can plan according to that. Okay, so these are different things. If you see this image, you can see that the cardiac views of third trimester, and you can see left outflow tract aorta smaller than the ductus venosus. Okay, so this is congenital diaphragmatic hernia. If you see, this is baby's head, and you can see this is heart, and there is some gas filled in the right side of just congenital diaphragmatic hernia. And you have small bowel dilatation in this, and here you can see the kidney with dilated pelvic calcium system. Okay, placental abnormalities are also can be seen. And transvaginal ultrasound in determining the placenta previa and third trimester high predictive positive value of 99% and negative predictive is 98%. If placental edge is at least 20 mm away from the internal nose, then you can go for vaginal birth. So we can plan the delivery as well by means of third trimester ultrasound. And uh, placenta, if it is like, for example, bilobe placenta or suction choroid lobe, multiple gestation, you should go for third trimester ultrasound to rule out the eccrita spectrum and placental location. Vasa previa, if it is undiagnosed before birth, then higher mortality is there. So Vasa previa, if you want to rule out, you should go for third trimester ultrasound. So presentations like breech presentation, cord entanglement, like multiple loops around the neck, skeletal malformations like achondroplasia, small bowel gestation also, will actually monitor by from 26 to 28 weeks onwards. Larva gestation like 4 or more than or equal to 4.5 can be seen. Okay. Amniotic abnormalities, you can see alga dominans of is less than 5 centimeter AFI, poly is more than 25. We can see that. Okay. So if there is poly, you can suspect maternal diabetes or fetal abnormalities, fetal infection, chronic chromosomal or genetic abnormalities as well. Okay. There is a point known as POCUS. POCUS means bedside only you will do ultrasound. It's a point of care ultrasound in obstetric. It is conducted at bedside. Okay, no need of going to another department for going for ultrasound. So it is known as POCUS. Okay. Mm, sorry. Coming to this thing, one RCT was tried and it shows that see, doing third trimester ultrasound does not reduce the perinatal mortality. Okay, perinatal mortality does not reduce, but we can find out that the baby is small for gestation loss or you have the 3 loops of cord around neck, so can plan the outcome. Okay, that's it. And conclusion, even in ultrasound, third trimester ultrasound, you have abnormalities, you can do the ultrasound guide amniocentesis and confirm. Okay, that's it. And the last topic, sorry, the other last topic is should cesarean section on maternal request can be done or not? See, so it's a debatable one. Nowadays, cesareans are being increased. Like in 2020, it is 21%, and it is expected that by 2030, it can be 29%. Like 30% is cesarean without any indication. Okay. In a whole world, if you see, so sub-Saharan areas have less births by means of cesarean section compared to other Brazil, Turkey, and all, where there is more cesarean sections. Okay, cesarean section without any reason, and if the mother likes to have cesarean, is known as cesarean section on maternal request. Okay, because the mother is scared of lack of support, anxiety, pelvic floor damage, like sexual discomfort. These all are running in her mind, so she'll opt for cesarean. So WHO has justified limits cesarean birth by 10 to 15% in any region without any indication. Okay, and in India, states of Telangana, Andhra Pradesh have more number of cesareans, whereas Nagaland have less percentage. Okay. Um, So, private sector in India, almost 1 in 5 women are having cesarean section. So, coming to discussion, there are many risk factors for the women who have undergoing cesarean section. There is infections, anesthesia problems, bleeding disorders, and injury to the other adjacent organs, and they can't breastfeed immediately. They'll stay for longer time in the hospital. These disadvantages are there. Okay, and babies are also prone to develop non-communicable diseases like type 1 diabetes, asthma, childhood obesity, Crohn's disease, and all. Okay. Uh, Placenta excretas are increasing, like they account about 40% of hysterectomies and 20% of massive transfusion protocol because of increasing the cesarean section rate. So the women should be educated about the all possible negative outcomes before surgery. Okay. And some people are saying that special consent form for cesarean material request should be incorporated. Okay. So, in the absence of any fetal indications, cesarean section, plan for vaginal delivery only. And if she's having fear of pain and all, you should educate about her about the analgesia which you can provide to her. Okay. So these are things. So let me once revise the whole topics of AOGD, April 2025. First is laparoscopy. I told you whether varus is best or open is best. So you'll explain about the introduction, what are the types of needles and techniques. Then you'll tell advantages and disadvantages of needle varus, advantages and disadvantages of open technique. Okay, and varus needle was introduced in 20th century. That is another important point. And next is you have open technique. So what are the open technique advantages and disadvantages? You should tell about the optical one. Optical one is also important, the visual entry one. So what are the different entries? Speed, risk of injury, susceptibility of radiation, incision type, pneumoperitoneum created how much fast. These should be educated to them. Other new one which is on study nowadays is Verisi. This is one more thing, and it is almost 2 mm in size compared to open technique. You should explain about that. And what to be used depends upon the patient factors and surgeon's one. Second topic is contraception to the teenagers. Yes, 11 to 13 to less than 19 is teenagers. So WHO and American Academy of Pediatrics says that you can give contraception. Okay, and POXO in India says that you report the case and as well as give contraception because there is risk of unwanted pregnancy, STIs, HIV prevalence can be decreased. And and we should go for one-to-one time discussion with the teenager. LARC is provided like implants and IUDs. For emergency contraception, you can go for morning pill and IUDs. Conclusion is you should go for sex education, emergency contraception. Okay, coming to um, coming to the vitamin D in pregnancy. Vitamin D's pregnancy is deficient because depending upon the ethnicity, race, and all. It because of vegetarians and winter climate are not exposed to sun foods, and even egg yolk is present. And vitamin D synthesis is first with skin, then goes to liver, then it goes to kidney, and finally you get cholecalciferol. Last one is calcitriol. Okay, so if there is deficiency, that can lead to rickets and bone disorders. Okay, next is